So when he ran to the basement, all the parents heard was pow, 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 and he was dead.
In part 1 of Black, Autistic, and Safe, we told you about autistic 15-year-old Stephon Watts from Illinois. Calumet police shot and killed him inside his home after he had a meltdown in 2012. Color of Autism founder Camille Proctor explained how police said Stephon lunged at them with a weapon.
The cop said that Stephon pulled a knife on him, but it was in fact a butter knife.
Stephon's sister, Renee Watts, told me she didn't want to relive the traumatic story in an interview, but allowed us to share part of her talk she had with the advocacy group Disability Lead in 2021.
Instead of getting officers with compassion, life experience, or patience, my father was met with 2 overworked, stressed out, hostile police officers who were tired of dealing with Stephon. In the aftermath of the shooting, the police chief of Calumet City said that Stephon had made poor decisions.
But anyone who understands the dynamics of autism spectrum disorder knows communication and decision-making are some of the challenges with the neurological disorder. The Mayo Clinic defines ASD as a developmental condition that impacts how a person perceives, communicates, and socializes with others. Symptoms range from mild to severe. And the CDC says the number of children diagnosed has gone up from 1 in 88 children in 2012 to 1 in 36 today. NBC's senior medical correspondent John Torres spoke on the Today Show about what's driving the numbers up.
It looks like the majority of increase is because of increased awareness and screening, and that's happening right now. As a matter of fact, the American Academy of Pediatrics didn't recommend routine screening for autism until 2008. And now what they recommend is screening for autism at 18 and 24 months and developmental screening for all the other developmental milestones at 9, 18, and 30 months.
Although he added more Black and brown children are getting diagnosed, African-American Dr. Adia Spinks Franklin told me that disparities in diagnosis and access to care still continue. The board-certified developmental behavioral pediatrician says her research on this is extensive. Why do you believe that there's such a disparity when it comes to diagnosis for Black children?
The short answer is racism. The long answer is multifactorial. For one, when it comes to media and marketing campaigns to increase public awareness of the diagnosis of autism, those campaigns do not usually center the voices of Black, Indigenous, and other people of color, brown people, right? They're often center the voices of suburban, middle class, affluent white folks, which the majority of people in the country are not. So they can't even relate to a condition. If you don't see it, you don't know you can have it or be it, right? So that's part of it. So when you look at studies, there's actually less information about developmental disabilities, behavior disorders, mental health conditions in Black, Indigenous, and brown communities, period. So that's one of the issues. Secondly, the criteria that we use to diagnose these disorders were not tailored based upon various cultural perspectives of development and behavior. Does that make sense? So sometimes the manifestation of autism might vary depending upon, or even how the parents report it, depending on how they interpret their child's behaviors. Also, let's look at the providers, the physicians, the nurse practitioners, the PAs, who are overwhelmingly white, right? Only Black. 5% of physicians are Black. Only about 8% are Latino or Latine. About 20% are East and South Asian. The rest are white. And so what we have found in the literature and research is that white physicians are actually less likely to ask Black parents specifically about their concerns about their child's development and behavior, even when it is abundantly clear the child is at risk or high risk for a developmental disability. So the white physician might give the screener looking for developmental delays in the child, but they're much less likely to follow up with the questions. They're less likely to take Black parents' concerns seriously, and they're less likely to do an appropriate evaluation to get the proper diagnosis. So Black kids are more likely to be diagnosed with things like ADHD, intellectual disability, which is the new term for mental retardation. they're more likely to be given that diagnosis and then way later finally get the diagnosis of autism.
Dr. Franklin added that delayed diagnosis for Black children puts their child and parents at a disadvantage.
Well, your window of opportunity for getting your child the services and interventions they need to maximize their development is in those first 3 or 4 years. And the average Black kid isn't diagnosed with autism until they're like 6, 7. So now we've missed this very important window of opportunity for interventions to be the most effective. It doesn't mean that a child can't get effective interventions at 6, 7, 8, and 9. It just means that your brain develops most rapidly in those first 3 to 5 years of life. That's when we need to be intervening to make sure your communication skills are maximized, that your learning is maximized, your social skills are maximized, so you can function to the best of your ability, and your parents can have the resources they need to parent you in the way that you as an autistic person need to be parented and need to be loved and communicated with. You know what I'm saying?
Back in 2020, the American Academy of Pediatrics reported a recent study revealed major delays when it came to diagnosing Black children with autism in the past. It reported Black children with ASD were diagnosed an average of more than 3 years after their parents expressed concerns about their development. Some signs doctors warn parents to watch out for include:
it affects their ability to socialize with folks and communicate easily with people. And it causes behaviors that are often unusual. The behaviors can be very repetitive, where they do the same things over and over again. Their interests can be very restricted, where they have very limited interests, don't have a lot of tolerance for new things or changes or unusual things. So those are the two main sides of it: the social communication part of it, and then the behavior rigidity part of it. And of course, it's a spectrum, right? So everybody who has autism isn't exactly the same.
Delayed diagnosis can often lead to delayed treatment and ultimately children growing up without the tools to manage anxiety and sensory sensitivity. Renee Watts and her family lobbied Illinois Governor J.B. Pritzker to sign the Stefan Watts Act in 2021.
3 major reasons why I believe Stefan was shot were because of class, race, and his disability. Our society is hardwired to classify people and treat them based upon these classifications. When our parents were looking for resources to help Stefan, we were met with resistance because Stefan didn't look like he had a disability. It was clear that the schools treated him as a child with behavior issues instead of a child with autism.
The new Illinois law, named in honor of Stefan, is also known as the Community Emergency Services and Support Act, or CESA. It prohibits the use of police officers for health or medical emergencies. In other words, police officers aren't allowed to respond to mental and behavioral health emergencies. But some advocates believe this should be put in place across the country.
It grieves me a great deal when people call the police because they feel like, well, who else can you call? What else can you do? And that can exacerbate things and make them worse, unfortunately.
Dr. Morenike Jiwa Anaiwu is an adult diagnosed with autism. She works with nonprofit organization Advocacy Without Borders. She says there has to be a larger effort to address mental health and training.
And a police officer is not a social worker, not a case manager. Maybe if there were some multidisciplinary teams to address some of these things, it would be better. And I also wonder how much of this is developed with the input of families in mind and of self-advocates, and like how much of it is it a group of professionals who put together what they think is the best thing, and you ran a 30-minute focus group where you had somebody rubber stamp it and now it's supposed to work. Do you have the input and the buy-in of the community? Is it culturally affirming the material and relevant to the population that you're working with?
PsychiatryOnline.org reported in 2021 that although police data is limited, estimates suggest at least 25% of fatal police encounters involve persons with mental illness. 76% of individuals killed in police encounters have had previous mental health treatment, and the fatality rate for Black people are 2.8 times that of their white counterparts. despite Black victims being less likely to be armed.
It has to be organic and they have to actually care.
Color of Autism founder Camille Proctor has conducted police training sessions for the autism community and says she found the process needs to be more than just academic.
So we had a program where we took teenagers, such as my son, and we put them in a group with, cops, sheriffs, different people from law enforcement. And they would meet on Saturdays just to talk about their special interests and likes and stuff like that. And so the reason we did it like that is because we wanted the cops to organically build these bonds with these kids, as opposed to in getting to know them, right, as human beings, not these theoretical things about a person with autism, they act like this, man. That's not true. So one good example I have is that I had one of the sheriffs in a place in North Carolina. He said, I walked up on this kid the other day. He sent me this email. He said, I walked up on this kid the other day and he was looking at this car and he was looking and looking. And I said, do you like that license plate? And the little boy said, yeah. And he said, and the reason I said that is because I remember your son likes license plates. And he said, and so we had a whole conversation about different license plates, historical. And he said, and this conversation went on for about 15 minutes. And he said, and before that, he said, if he was looking at a license plate, rest assured he was trying to break into that car or vandalize. He said, but prior, and this is exactly, he was fully honest with me. He said, but now I look at it a totally different way. He said, because that young man was looking at the license plate and he was flapping his hands. And he said, I remember your son doing it. He kept referring to my son. He said, I remember your son used to do that on Zoom. He used to go whoop, whoop, whoop. And he said, and I knew what I was dealing with immediately. He said, I knew. He said, so I thank you for the opportunity for me to get to understand these young people better, and so that's the type of things that I think are transformative in regards to teaching and educating a police force.
Proctor also believes it will change when police academies and criminal justice classes include addressing the special needs community in the curriculum.
The last thing a mother or a father wants to do is bury a child.
Yes.
They don't have sections in the police academy curricula that talks about people with special needs. Have modules on these things so that these people that are in these academies or these people who are choosing these careers can get well abreast on what to anticipate when they get out there on the streets. Don't keep putting people out there and saying, protect us. And then they see something that they deem as odd because they're not educated and a bad thing happens.
Dr. Marinike Jiwa Anaiwu agrees, and she also wants to strongly address what some have offered as a solution for parents with children on the autism spectrum.
I don't think any fault of their own. They often say, you need to introduce your children to the police department.
That stuff makes me upset when people say that. I'm so sorry for interrupting you, but I knew exactly what you were going to say. Take your child to the police officer and introduce them to all the officers on duty and let them understand what they do and who your child is and what they look like and all that. And I think that's really well-intentioned. And I applaud the spirit behind that. But I think that in reality, that's not going to work. First of all, so no one's ever going to have a day off. No one's ever going to be new. Like when you brought your child in that day, January 2022, there's been no staff changes since then. There's never anybody on, like medical leave that's been covered by someone from another county, or there's never a temp, or there's never a new hire, or there's never someone who just didn't remember because your child was one of many that got brought in, or or your child was brought in. That's nice, but how do they know your child's not under the influence, in their mind or whatever? Like, I think people give themselves a false sense of security. I do think that there is some benefit to doing that. Like if your child is a wanderer or elopes, sometimes you might not have an up-to-date picture. So sometimes the people having seen your child, knowing a little about your mannerisms, it's not that there's no benefit to doing that, but it is not like a preventive measure for your child not being restrained or misunderstood or potentially harmed by these officers, even if they have seen and know who your child is. If anything, you might be feeding or fueling any stereotypes that they already have about someone with disabilities by bringing them in. You don't know what context this person has just because you're introducing your child, that, you don't know what their perspective is of people with certain disabilities. Do they see them as a danger? Do they see them as a threat? Do they see them as out of control? So, we're looking through the eyes of a parent with love. That's not the eyes they're looking through.
Although many autistic adults and advocates agree that police training should be standard across the country, it isn't. Spectrum News reports recruits at Riverside County Sheriff's Department in California are required to complete 15 hours of autism training, plus an additional 4 hours once they're hired. But in other places, training could be a 15-minute video. Quality and quantity vary. That's why parents and those living on the spectrum say they take added precautions.
The traditional be respectful, put your hands where they can see them, no sudden moves, and what have you. That has actually, quite frankly, evolved to a simple statement of survive the encounter.
Next week on the extended version of Part 3 of Black, Autistic, and Safe, we hear from Black parents, caregivers, and autistic adults about what they teach their kids to stay safe. I'm Esther Dillard on the Black Information Network.